To me, showing the recipient sites, that is the actual design of the pattern I create, is as important as just showing the before and afters on my website. I think that without really understanding why the recipient site pattern allows a surgeon to create consistent results, then you could show just the best of your work and not really understand that on a consistent level, the design is integral to the success of a successful hair transplant procedure. With that in mind, I want to walk you through how and why I designed this gentleman the way that I designed his recipient sites, that is. In this case, on the far left you see a overview of the entire recipient sites, almost to the hairline, just couldn't fit the whole thing in the image, to the back of the mid-scalp. So his crown begins right here. So what you're seeing here is that there's a higher density gradient here, and then there's a lesser density gradient here. Even though this is a mega session procedure with about 3,000 grafts, I still want to prioritize this frontal region. And then to define the frontal region in more specificity, this is the central forelock. The central forelock is an area of prime importance. This is the hairline, as obvious as you can see close up of how natural the hairline. These little sentinel hairs that stick out define the part of the micro hairline. And the other thing I want you to see is that, let's finish the density gradient. You see the density gradient going farther back from highly dense, medium dense to slightly less dense, because even with 3,000 grafts over a very wide area, you have to allocate those grafts in a way for maximal aesthetic benefit. So if you just place it equally throughout, of course you'll have a nice result, but not the level of niceness that I'm delivering here, where I'm getting a much more powerful central forelock frontal temporal recession, and then I feather that back to the areas of slightly less importance, because also these hairs are going to be combed back. The second thing I want you to understand is the hairs are all going straight forward. All the recipient sites are designed straight forward. I see too often the recipient sites going side to side, forward. If you don't design them in the right angulation, it doesn't matter how good your assistant team is, the recipient site design is going to lead to a better outcome. You're also noticing a slight convergence. What convergence essentially means is the hair sites are going toward the center of the scalp. I don't know if you can see that. Slight convergence. You don't want an aggressive convergence, a slight convergence. There's a couple reasons for the convergence. Number one is you want everything aiming toward the center. When the center is weak, the person feels like there's no results. You want to angle them toward the center to get the maximal aesthetic impact. The other thing that, another reason is that the scalp is curvilinear, in other words, rounded like this. So the hairs naturally want to fall off the scalp going in this direction. So by creating a convergence pattern going to the midline, you can create more visual density to the side and limit the chance of the hairs falling away from where you want. Now, as you go toward the lateral few centimeters of the scalp, going over to the scalp hairs, you want to slowly, gradually transition laterally. There is no abrupt transition on the scalp when you're looking at a natural head. So you don't go from here over to there. You want everything to slowly, gradually turn, but you want that turn to occur really in the lateral centimeter. So you don't want it to be slowly turning from here. Otherwise, everything will book leaf open, and it'll be the opposite of convergence pattern. It'll be a divergence pattern, which is exactly what I see when I teach my students in St. Louis, and it just doesn't look right. So if you take a look here, these hairs almost go this direction. So you want to slowly blend going this direction. So that convergence pattern this way leads in the lateral few centimeters toward a little bit of angulation that matches the frontal temporal angles, and that's very, very important. I encourage you, if you're going to pick a surgeon, pick them not only just based on the before and afters, but on the design, the actual design. And unfortunately, I don't think there's another surgeon out there that is as focused as I am in showing case after case of recipient site design. So this is just showing the number of grafts placed. I actually use this in my electronic medical record on the bottom left, one for a record of what I did for the patient, so I come back, I can take a look at this, especially if I do a second session for him. It's very helpful to see what my previous game plan was. Also, it's very helpful to have this printed out. I have this printed out in the room, so my staff, besides verbally telling them what I designed, they have a blueprint of how to place into this design pattern. So this is just a understanding of a mega session. that's placed even in an area that doesn't even reach the crown is still distributed in a fashion for maximal aesthetic benefit. And I just want to emphasize why design is so important, always.